Tens of millions of families with Alzheimer's disease and dementia all over the world, including our family. We are Alls in the Fam. I'm Allan Fair.
And I'm Poli Fair Noise. We're siblings, we are parents, but we're also caregivers.
This is our podcast. This is our support group. Welcome to our family. Alzheimer's sucks, but this family lives, laughs, and learns as we fight for a cure. Welcome. Hey, welcome to Alls in the Fam.
Hey, Allan.
All right, Allan.
We're good. So we're going to talk about a really exciting topic today, COVID-19, which may in and of itself isn't very exciting, not at all actually, but the vaccine is. And today we're going to share, you may have seen on our Instagram that our mom has received her first vaccination. And we came across the Alzheimer's Association website, alls.org, which we refer to often and contribute to as well. And the current homepage on the site right now is about answers for dementia caregivers and people living with Alzheimer's with regard to the vaccine. So we're going to use that as our guide today. And so just to start out, we've talked about in previous episodes, but in the late spring, early summer, our mom, who lives in a memory care facility, did in fact contract COVID in a pretty major outbreak in her facility, both among residents and staff. We all remember that. She didn't have any symptoms other than she couldn't smell or taste anything, but otherwise felt fine. That was a pretty interesting time, right, Poli?
Yeah, so it was the beginning and there wasn't as much testing as there is now, just wasn't available. And they wouldn't have tested Mom if they weren't testing every single person in the facility. And she never reported that she couldn't taste anything. She just wasn't drinking or eating very much. And so they said to her, well, why aren't you eating or drinking? And she said, well, I can't taste anything anyway. And that was difficult because they wanted to isolate her. So we're sure glad the vaccine is here now to stop other people from having to go through what our mom went through. It was really the treatment for keeping the rest of the facility safe from others who had coronavirus or COVID-19. That was the most difficult thing for people with Alzheimer's because they were isolated.
And don't know why. They don't understand why.
Right.
And so fast forward, we now have one vaccine on the market with more on the way. And the way it's being handled in the United States is that all 50 states are adapting their own plan. And our mother is in the state of Maryland. Do we want to talk a little bit about what the experience has been like with regard to the rollout?
Yeah, so I'll lead in here and let you guys jump in. It's wonderful. The vaccine is available and they prioritize people living in congregate facilities to get the vaccine. So our mom is in an assisted living facility, a memory care facility, not a nursing facility. And at first we were told she would get the vaccine before the December holidays. And it turned out that was a mistake because when they realized in our county in Maryland that she was not actually in a nursing home, but an assisted living facility, her facility's number was moved further back. And she actually just got the vaccine on January 30th. So more than a month later, but still she's gotten the first dose. Yay.
I think all of us just have to be patient with regard to how it gets rolled out, even in our most vulnerable populations.
Right. So I got a form to fill out to authorize giving my consent for her to receive the vaccine. And I think I got that in late November, hoping that it was coming soon. And I filled it out. And of course, we the facility where our mother is really hoping to vaccinate 100% of the people as a way to protect everyone. I've heard news stories that maybe not every staffer wants to get vaccinated, but I don't know in her particular facility if that's the case. So, we had some discussions about that, consenting for our mom. I mean, Boni, you and I definitely talked about it.
Yeah, I was with you, Poli, the day that they actually handed you the form. We were sitting outside with Mom, and we were trying to get her to sign it.
So that was for the flu shot.
Oh, you're right. You're right.
Yeah.
Yeah, and I think we've touched on the topic in this podcast as it relates to the flu, and it's certainly, I think it is one of the most unique aspects of consent is with someone who has dementia and is able to have an opinion in the moment. They're not incapacitated in the same way as someone who has a mental disability, at least, or a more progressed form of disability that doesn't allow for them to make their wishes known in the moment. So, I think that's a very distinctive feature that for dementia patients, where does consent lie and how do you make the decision for your loved one? Or do you make it for them, and what happens if they don't comply?
So I have a question that I don't know. I think either Poli or Boni or all I know is that I am not Mom's medical power of attorney. If we wanted to, as her power of attorney, could we tell her facility that we don't want her to get vaccinated? And even if she was saying, I want to be vaccinated, they would have to respect our wishes?
No. So if she physically refuses to get the vaccine, they can't hold her down and force her to. That's the thing. Now, if she was in a coma or somehow physically incapacitated, unable to speak, which happens with people with Alzheimer's, they could do it if we requested it and she was unable to voice her total desire not to be vaccinated. And I guess, this brings up an important point. Our mom we knew with the flu shot, she never wanted the flu shot for years before. She was over 65, didn't want it. She got it one time at Trissi and Boni's urging that she must get it, and subsequently got the sickest she'd ever gotten with the flu. So that just cemented in her mind that she was not going to get the flu shot ever. And so we actually talked to her, Trissi and I together, about the flu shot. And she said, no, absolutely not, no. And given that she'd had this reaction before, either to the flu shot or actually got the flu after getting the flu shot, we just kind of left it at that. I said, my mom doesn't want the flu shot. And I'm told that there are many people at her facility who did not want the flu shot. I mean, anyway.
Well, and in addition, if you're talking about our mom in particular, not just to the flu shot, she is deathly afraid and dislikes needles altogether, and has always been very reticent about taking any kind of medication, preventive or as not thinking of what the word is, to make her get better. She's always been one that's refused most medications, and certainly anything given to her in a needle. So, and Poli, your point is exactly what I was saying, is that our mother has an opinion and she's going to have it at the time. So they asked for consent from Poli because she is the medical power of attorney, but they can't override that. They can just do the best they can to have her consent. And so, it's just something that you have to be prepared for if your loved one with dementia is able to voice their opinion at the time that the vaccine is going to be given. So I don't know, Poli, we just went through that, and Poli, I think we were discussing Mom's reaction and how the facility managed it.
Yeah, I think Mom was ahead of her time with homeopathic treatments. Just a little aside here, always kind of distrusted doctors a little bit, and I wonder how many of our listeners were put through the torture of taking cod liver oil as children. And also had the pleasure of, when they had a cold, being given a nice little cup of, let's see, I think it's lemon juice, ginger, and a big shot of rum to make your cold go away.
Oh,
And
I never
honey.
got the rum.
Oh
honey.
yeah,
But
Yeah.
I never
honey.
got the cod liver either. I did get the ginger tea though, which I still enjoy to this day. I like
Oh.
ginger, lemon, and honey. That's the
Well, you got to put a shot of rum in it. That's like
Yeah.
the best
If
thing.
you're congested, it's rum, honey, and lemon.
Mhm.
I didn't always get the ginger in it, but
Mm-mm. Not
you're
in
younger.
That was a
that
separate
was an
one.
upgrade.
Yeah.
Yeah, rum, honey, lemon, and then ginger was an upgrade. And then when my kids came around, she would try to do that too. And she finally resorted to sending me to CVS to try to find Coke syrup or an actual Coca-Cola to give my kids when they had a cold or a stomach
A
ache.
stomach ache.
That's
yeah,
for the
that's the
stomach.
stomach ache, right?
Yeah.
Okay.
That's
Yeah.
that's the shit. That's to settle the stomach. Which ginger ale too. Those were the two
Yeah.
things that were.
Oh
Right.
yeah, ginger ale. Yep.
Mhm.
So she was, she was homeopathic.
Well,
And she's
circling
extra sensitive
back.
to needles.
Yeah. Circling back, I wonder how much of our mom's experience as being not an immigrant, but from Puerto Rico, is the basis of her distrust of the medical establishment in general.
Yeah.
It's not that we were all vaccinated for everything, childhood vaccinations, but she is a person willing to question, and why should I get this? And I imagine if she didn't have Alzheimer's, would be questioning, how well was that vaccine vetted? Do I need to go first? I wouldn't see her first in line if she didn't have Alzheimer's. Just,
No,
honoring her
definitely not.
personality there. I can't see that.
100%.
Yeah.
I agree. 100%.
Yeah. Yeah.
But
And I remember, another blast from the past, Reader's Digest. I remember specifically her reading that cover to cover, and one time saying, I'm a woman, I'm a small woman, and these drugs that they talk about, I just read in this article, were made for men. And that's something that's in the headlines still today. And this must have been, 30, 40 years ago. She was telling me that she didn't trust any medications.
right.
it maps to some of the things that we've learned in talking with Bridget Reynolds at Georgetown University, that minority populations are less trusting of medical establishment. In Alzheimer's research, there's very little data on African American and Hispanic populations, and so our mom is very much part of that community.
Yeah.
I wouldn't say she's an anti-vaxxer.
Yeah.
I mean, all of us got vaccinated.
Right.
I remember her being terrified of the AIDS virus, and therefore, I don't know, maybe everyone was terrified of the AIDS virus in the 80s, but I was a kid, and man, I remember like our mom being very concerned about that. So if she had all her marbles, it would be interesting to see if she would want to be lining up to be among the first to get this vaccination.
Yeah. Well, let's get to the punchline. So I did sign the consent form for her to get the COVID-19 vaccine. And on January 30th, she got it, but not before I got a phone call that morning from the person administering the vaccine, someone I did not know. I don't know if they worked for CVS is administering vaccines at her facility. They have a contract with, I don't know, the county or the state to do it. And a person from there called me and said, your mother doesn't want the vaccine. And will you talk to her? And so I talked to mom, and this was funny. And I said, Mom, please get the vaccine. Otherwise we can't see you. I really want to be able to see you. If you get it, then it'll protect you and me. And Bonnie and Trissi and Allan and I all want to see you. And she said, I can see you. What do you mean? I want to go home. And I said, no, I really want you to get it. So she said, okay, fine. And threw the phone off to the person who had given her a phone. And the person said, okay, Carmen, you're going to get the vaccine now. And she said, hell no. Typical of my mom. She said, and they said, well, you want to see your daughter? And she said, yes. And she said, well, they said you can't see her unless you get the vaccine. And she said, then I won't see my daughter. And that was it. And the phone went dead.
Wow.
So I was left with, oh no, what will we do? So I called some of the people in the facility that I still know. Didn't get through to them, didn't know what was going on. And eventually one of them called me and said, hey, your mom's going to get the vaccine. And I said, she knows you, go talk to her. And so they sent me a picture later, and the facility did a great job. There were 5 people that took mom, like it was a big party, clapping and balloons, and walked her downstairs to the lobby area, which is bright and sunny and beautiful, and sat her in a chair and made it a big celebration. And they got her to get the shot. So I got a phone call from the nurse there a couple days later, and she said that mom had no side effects from the first dose.
So that was dose 1, and
Right.
shortly,
Yeah,
she's going to get her second dose in the next couple weeks.
it is scheduled
so.
20 days later, exactly. And they've told me that they're planning to do the exact same procedure to get her to take the vaccine again. Yeah, that ritual that. So, I mean, shout out to the staff there, really working hard to get just one person or mom to get that vaccine. But you have to wonder if they're able to take that kind of effort for every single person. And it brings up a lot. I mean, it was really a concerted effort to get my mom to change her mind. One of her, I wouldn't say it's core values, but one of the things that is important to her is that I'm not sure I trust this. Are you making me, I don't know. You're making me get it.
Yeah, and I think you can even break that down again into, for the decision making for us, she already had the virus, so we know she had some immunity to it, and she did agree to do the first vaccine, but now we're coming up on the second one, and will she consent again? And then how far do we push that, given that we know that the first one it's more protective than the new one that they're coming out with, that you only need 1 dose. Yeah.
Just 1 dose of the 2-dose thing.
Mm-hmm. And then the second, and there's evidence that when you take the second dose, the incidence of side effects is much greater. Yeah. So, that we've got another decision coming based on what her reaction might be at that time.
Yeah.
Right. I'm glad we have a little more time, because, it'll be interesting to see if the CDC comes up with new guidelines because of, people like our mom who have had COVID, who had 1 dose, should they get that second dose? I think right now they're still recommending that it's done, but
yeah, and very limited data on it at this point, too.
Mm-hmm.
I mean, the number of people in the United States that have had their second vaccine, it's very small. And we're in an interesting situation knowing that the few times she took the flu shot, or the most recent one in memory, she contracted the flu that year. So is she someone who's going to be prone to any of these potential allergic reaction? I'm not sure that any of us are personally hand-wringing over it, but this has got to be a question on a lot of people's minds who are caregivers, or my loved one has shown an allergy to medications in the past. Will they have an allergy to this one?
Yeah.
And depending on the symptoms, not self-report it, because if the symptom is something like what our mom had when she was actually sick, which is, she didn't taste and didn't smell and slept a little bit, which they really figured out in retrospect. So it wasn't that someone noticed that was happening and then, oh yeah, the COVID is what happened. She wasn't tested because of it. Once she came up positive, they said, oh, we had noticed she wasn't eating and drinking that much. And when we asked her, she said she did nothing tasted good.
Right.
So, so again, with the being able to self-report on the back end of what their symptoms might be, is another thing you have to remember and take into consideration when you're deciding for your loved one, especially if it's not going to be their primary wish, to go ahead and get them vaccinated again.
I'll point out that if my loved one was a person who maybe was more like one of Trisi's in-law, who isn't really going to leave the facility, I think my focus would be more on vaccinating everyone around her, right? If she didn't want the vaccine, maybe, I mean, she's got some paralysis, some nerve pain, adding to that pain with a shot that might have lingering. I mean, I'm a baby. When I get a flu shot, my whole arm swells up and it hurts for 3 days. I mean, it's fine. I'm a big girl. I can put some ice on it and take a Motrin or a Tylenol or whatever, but that's a different thing when you're talking about a person who's already in pain, or at least existential pain, right?
Right. And we had a very similar situation with her, saying, okay, I'll get the vaccine. But when the time came, she didn't want it, but a very different result. She, like you said, Polly, will not be leaving the facility. But she had COVID like mom, and recently had COVID. So we were kind of like, they say she's recovered, but she is on so many medications that we didn't really know how bad her case was, because the medications that she was on were possibly masking symptoms that she would have otherwise had. She was on a blood thinner for blood clots. She is on a lot of pain medication. So in the moment when she said she didn't want the vaccine, we tried to convince her a little bit. We were on the phone with someone who was with her, went through all of that. And in the end, we just decided, she's not going to be leaving the facility. They're already on the second vaccines for everyone else in her facility here in Virginia. And we just said, you know what, if she doesn't want it right now, let's wait.
Yeah.
So.
I mean, I think that's a valid decision as well.
Absolutely.
And one that mom might have made if she was able. So, I will say that there is no peace in any decisions you're making for an Alzheimer's person, because there's so much to consider. You consider their health. Do I know better than they do about themselves? I mean, the old Seinfeld thing, should they have domain over their own body? Right.
Right.
Well,
a different context than that particular Seinfeld episode.
Yes, absolutely.
Yes.
But I do think, Tracy, you bring up a big point that wasn't as much of a point for us, which is, a lot of dementia patients are on a whole host of other medications, and there isn't a lot of data for medication interaction, because there isn't a lot of data for anything with this. So, we didn't have that as a consideration, but that's huge.
Yeah. Interesting, and I believe rightly so that they are the most vulnerable population. Therefore, they should be the first people to get the vaccine. On the other hand, they're sort of guinea pigs when, maybe should have had, healthy young adults get the vaccine first. But that's what the trials were for. And those were successful. And I do believe that the FDA in that regard, smartly really did good randomized clinical trials.
I also wonder how people are doing if they're taking care of their loved one with dementia in their own home, right? So to get a person out, to wait in line, there's places you have to wait in line now in Montgomery County to get a vaccine. I think that's another concern. Like, is it worth it? And then are they going to vaccinate the caregiver in the home who's taking care of them? Because at least in the state and county where mom and I are, it's congregate facilities only, right? So prisons are also being vaccinated at the same time as mom.
And it's the same situation in Virginia as well, where caregivers in the home who are not medical personnel are not considered in the hierarchy. So if you have an aide that comes in, your aide can be vaccinated as a healthcare worker in their turn, and they get priority, but not if you are if you're a relative or a caregiver who does not have a medical designation.
Interesting.
I think in some ways, deciding which answer is best for a caregiver or a caregiving family is leaping ahead to the worst case scenario, which is what if they get it, become symptomatic, and have to go to the hospital. And the idea of your loved one who has Alzheimer's being alone in a hospital, that's a pretty scary thought. And I think that led us, when she had it, to re-looking at some of the forms that had been filled out for mom to make sure that in light of pandemics and other things, that what was filled out on those forms are going to continue to be relevant and the right decision for us and our mom going forward.
Right. Yeah, you got to have an advanced care directive to state, how do you want them sent to the hospital? Do you want them ventilated? All that. So who's the person who's going to make those decisions? It's hard. But yeah, the vaccine still, I consider good news, but understanding that for a lot of people, it's a decision for us too, really fraught with just so much, so many concerns.
Yeah, I'm sort of glad I have to wait a bit to get it, as much as I would love to have it and be able to go about my life as usual. I'm not too upset that I'll probably, be one of the last people to get it.
Yeah, in a way, it's selfish. We got mom vaccinated so we could see her, so she, right? I mean, if she's, the other thing is, you don't know that all the staff, I don't think it's mandated that the staff get vaccinated at these places. You can't make them. And many of them are in groups that are distrustful of medicine, right? Like our mother. So I don't know if they got it or not, but our mom could be a carrier and spread COVID to my family if I had her come to my house and she wasn't vaccinated. So
yeah, interestingly, I read, and I'm sure you guys have, and our listeners, I think it's very interesting that some companies are not forcing people to get the vaccine because they can't, but they're offering financial incentives if they do so.
Yeah, I saw that too. Again, I have not been told whether mom's facility is doing that. And, I mean, the people who work there deserve privacy as well. I don't,
Yeah.
Anyway.
That is going to be very interesting to see how all of this shakes out. The number of people that
I've been fascinated by how we're developing a two-tiered society of the vaccinated and the unvaccinated. And I read an article about the Cayman Islands and how they're being very strict about who they're letting in and if you have a vaccine and you can have proof, and that some airlines are doing that now too. They're doing flights for people who are vaccinated versus not. So it's just going to be interesting overall.
Right. So I work in live events, and as we forecast when people will be able to gather again at business conferences and meetings and other things, it's top of our mind as well. What kind of forms will people be required to sign to attend, releasing an organization's liability for bringing people together? How might privacy rights and other things sort of merge together and make that process be, I guess my point is that there's a lot of unknowns that are going to converge among the vaccinated, unvaccinated. How organizations will deal with that and how that comes to a head is going to be really interesting.
Working in HR, I feel the same way. I mean, how are you going to handle that? I think it's going to involve a lot of testing, right? But I think there's lots of news articles about the limits of testing. You don't need me to describe it, but yeah, we really are on the cutting edge of some new things, and we don't know how that's going to happen.
If you remove the politics of it and just look at some of the innovations that are happening with new treatments and therapies in the field of healthcare. It's really amazing, whether it's right for you, whether you're an anti-vaxxer or not, just how medicine is now coded and worked, and how we can ship things on proteins to cancer cells and other things is really, really fascinating. And I think that the opportunity for these pharmaceutical companies like Pfizer and AstraZeneca, Johnson & Johnson, I think there's an opportunity if the story ends the way that I think we all want it to. Is this an opportunity for big pharma, instead of being, known for drugs for profit? Can this be the story of how healthcare companies were able to come together and help in some way, play their part in saving the world?
Yeah. Well,
Right.
Tying it all back, there's the ethics and the moral piece that isn't necessarily legislated fast enough to affect the decisions that we're making with our loved ones. And just with, I find that to be fascinating, the ethics of medicine and the morality and the individual decisions that we're making that wrap into society and how it's going to affect us. And we're taking a very quick, unusual, brand new situation in the entire world, and we are, deep diving it all the way down to our own personal situations, and that's how everybody's making their decisions all around the world. So it's just a fascinating time and a very difficult journey that we're on here together.
Right. With a lot of time pressure.
A lot.
Everything as fast as we can.
Absolutely.
Yeah.
It's life and death, literally.
Yeah.
Right. And I think we all personally feel a part of it on that journey. We're genetically predisposed to Alzheimer's. We see the stats, we see the math, the freight train as boomers continue to age. There isn't this bullseye therapy that we can specifically point to and say that it's going to intersect at the perfect time, where if we have plaques that are going to form and our memory is going to go, that anything will line up in time to be of help to us. But we certainly hope for that and for everybody, because if not, the milestones look pretty grim as to where we'll be with Alzheimer's and lack of proper healthcare for it.
I do think that one of the things the pandemic shows us is what the world can do when they single-mindedly put together all of our resources and intelligence to try and solve a single problem. So, part of what we're doing is bringing that focus to Alzheimer's, which is now considered to be one of the top diseases affecting the world overall. So, if we can move the attention a little more towards it, I think we can be much faster. We can move that needle much faster. And comparing it, if you look what we did here with the pandemic, let's do that for Alzheimer's right now.
Warp speed.
Yeah.
Please.
Yeah. I agree. Well, on this journey that we're on, I sure am glad to be on it with all of you. Good to have siblings to go through the not so great stuff with in life as well as the great stuff. So we'll link this article. It's an FAQ about all things coronavirus vaccine with Alzheimer's and dementia patients, and hopefully just our perspective being somewhere along in the journey of where we're at with our own mom's vaccination process. Hopefully that's helpful to some. We are Alls in the Fam. See you next time. Thanks for listening to Alls in the Fam. In the fight against Alzheimer's and dementia, we are all family. Find us at Alls in the Fam on Instagram, Twitter, Facebook, YouTube, and on our website, allsinthefampodcast.com. We appreciate you clicking that subscribe button on Apple, Google, Spotify, or whatever your favorite podcast catcher may be. Alzheimer's sucks, but we are in it together. We are Alls in the Family. Talk soon.